This is Dr. Supriya Patil Ganeshwari, a general dentist with prime focus on cosmetic dentistry and children's dentistry.
Have you got a single, discolored front tooth? All the teeth have the same color. But when a single tooth has a different color, it just sticks out and spoils the entire smile. It's the discolored tooth that gets highlighted and easily visible to everyone.
There could be many reasons for these, but the most common reason is the trauma to the tooth. By trauma, I mean to say any kind of injury to the tooth. It could be either a fall on the tooth, a direct blow over the tooth, or an indirect injury wherein the lower jaw forcefully bangs on your upper tooth. The discolored tooth could be anywhere in the upper front teeth or the lower front teeth. Now this trauma may have happened many years back, but the discoloration is seen later on. Sometimes it so happens that you have had this trauma as a child and the discoloration is seen when you become an adult. You might not even remember whether you have had this trauma. Why does the tooth discolor after a trauma? Each tooth has three layers. That's the enamel, dentine and the pulp. The pulp, which is the innermost layer, has nerves and blood vessels. Because of the nerves, we feel the sensation of hot and cold when we are eating something. Now, when the tooth faces some kind of trauma or an injury, the blood vessels and the nerves both get damaged. The blood vessels break down, there is some amount of bleeding, and the broken down blood vessels remain inside the tooth. This causes discoloration of the tooth. The nerves are also damaged, and hence the sensation of hot and cold food to that tooth is lost. Since there is no blood supply to the tooth, the nerves do not heal and they start to rot. Over a period of time, our body's immune system recognizes this rotten nerve tissue as a foreign body and it starts its own defense mechanisms. That is why we do not have any kind of pain or any symptoms over a long period of time. However, when the microbes due to the rotting nerve inside the tooth increase and our immunity goes down, that is when the symptoms start to begin. You might experience some kind of pain in that tooth. There might be a small boil over the gum, or there might be a huge swelling, maybe inside or outside the mouth, or there could be just pain when you're biting. This means that the infection has spread. It has caused some kind of an abscess or pus beneath the root. What is the treatment for a discolored tooth? If the tooth is discolored due to trauma, then the tooth will require a root canal treatment. A root canal treatment is a treatment wherein the canals that are holding the nerves and the blood vessels, which are now damaged, these canals will be cleaned up thoroughly and then later filled it up. The tooth's discoloration is masked using a crown or a veneer. A tooth whitening treatment can also be done. So if you have a discolored tooth that is spoiling your smile, then do pay a visit to your dentist. Also try to recall if you have had any kind of trauma. That's all for today. Have a nice day and keep smiling.